looking closer to the corner of the room there, first of all, would this be the bed where Michael Jackson was placed?
Yes.
Okay. And what's the term for this?
It's a trauma gurney.
Okay. And describe for us what we see then in the photograph beyond the gurney, all of this medical equipment here.
This tool chest is our airway equipment.
And you've indicated the large tool chest with appears to be colored doors, white box.
Yes.
Is that where you're pointing?
Yes.
Okay. And what type of airway equipment is in there?
There are endotracheal tubes. There are other advanced airway devices. If we were attempting to intubate a patient and we could not place an endotracheal tube, we have rescue airway devices.
Okay. And above this, the airway equipment, this monitor here, what is that?
That's the cardiac monitor that the patient who is in the trauma room would be placed on.
Okay. And what type of readings would that give you?
That would have a EKG rhythm and sort of heart rate. It would have blood pressure. It would have the oxygen saturation. If the patient had an arterial line, as Mr. Jackson did, the pressure tracing would be connected and shown on the monitor.
Okay. And this would all, the readings that would be on this monitor would be from sensors and devices attached to the patient?
Correct.
Okay. In this area then, in the photograph, which would be to the right of the airway equipment and the monitoring screen, what is shown here?
There is, it's a little hard to see. This is actually a portable monitor and defibrillator.
Okay. And you've pointed, is that this?
Where you see the red and
okay, to the right of the airway equipment?
Yes.
Okay.
And although it's not clear to see here, there's a ventilator here.
Okay. And then how about this device to the right of the defibrillator, this pole, and then a device on top?
Without seeing a close-up picture of it, I'm not sure if which part of our equipment this is.
Okay, let me see if I can. Are you able to tell, or is it too blurred?
It's a little bit blurred. I think this is one of our smaller ventilator devices and not our other airway device.
It's a smaller ventilator device?
I believe it's, there's an oxygen tank. I believe this is portable ventilator, and this is a bag valve mask, but I would have to look at be in the room and look at it to be sure I'm not misspeaking.
Okay. And going beyond that equipment, what is this cabinet here immediately to the right of that equipment?
This cabinet has several different trays, various equipment we would use in the resuscitation of a patient. This is a trauma bay, so there are tubes so that there are trays that we can crack a patient's chest open so that we can place tubes in people's chest. If we needed to do what's called a tracheostomy and sort of an airway where we went directly into the neck, that equipment is held here. There are central line kits, sort of type of IV kits that we will use.
When you said a tracheostomy straight into the neck, what is that exactly?
Instead of the endotracheal tube where we go through the mouth with a tube into the trachea, in some people that's not possible, and they will have an airway where we cut directly into the neck and place it. Emergency physicians typically will not put in a tracheostomy tube. That would be done by a head and neck surgeon, but we have the equipment here in case it's needed.
Okay, but that would be where you couldn't use an endotracheal tube, but you needed to ventilate?
Correct.
Okay. And then you mentioned at the bottom there the equipment for a central line. Is that what you said?
Correct.
And what's a central line?
A central line is, in essence, a larger and longer IV that allows us to access the central circulation quicker than would be a IV that was placed peripherally in an arm.
How is a central line put in place or administered?
So central lines are placed by the physicians. They are initially, it's what we call the Seldinger technique.
The what?
There's a special technique that we use where we use a needle to puncture the vessel. We then introduce a wire and guide the wire through the needle into the vessel. We then introduce a catheter over the wire into the vessel.
Okay. And going then to the right of the equipment you've described, and I'm going to switch photographs as we move through the room. People's 49. Looking at People's 49, you recognize this as the same cabinet you just described on the left side of People's 49?
Yes.
Okay. So going then, continuing rightward around the room, what is this cabinetry or glass enclosed location here?
That cabinet has some IV fluids and I believe IV medications.
Okay. And is that a refrigerated cabinet, or what is that?
I would have to ask one of my nurses. I don't access these medications.
Okay. And what is this cabinet then going to the right of where the IV fluids are?
That's what we would call one of our medication pyxis.
And what is that?
There are several drawers here, and medications that we would typically use in the emergency department are sort of locked in this cabinet.
Okay.
The nurse will log on to this computer screen, log in the patient that the medication is being used, identify the medication that is needed, and that drawer will be accessed, and they will then note which medication was taken from the cabinet.
Okay. So the medications are locked inside this cabinet, and then by use of this computer, one can gain access to the medications?
Correct.
Okay. Is it password protected or?
Yes.
Okay. Going then to the right, the Pyxis system, where you can see it from there. This cabinet here, what is that?
That's a cabinet that contains bags of IV fluid.
Okay. You're going to get into new areas. Is this a good time?
Yes, it is. Thank you. May we turn on the lights, Mrs. Benson? And the IC counsel, please. Ladies and gentlemen, we're going to take the evening recess and adjournment as well as the weekend adjournment. Please bear with me and give me your full undivided attention as I continue to deliver to you these admonitions and orders. Do not discuss this case among yourselves or with anyone else, nor should you form or express any opinions about the case until it is submitted finally to you. Do not visit any scene or location that may have been referenced, mentioned, or involved in the case, or perform any experiments, or conduct any independent research on your own or through another person on any topics, subjects, or persons mentioned or involved in the case. Do not come into contact with any television or radio programs, newspaper or magazine articles, books, or the internet regarding any topics, subjects, or persons mentioned or involved in this case. Do not access on your own or through another person any internet website, including but not limited to any search engine site such as Google, Ask, or Bing, or social networking site, including but not limited to Facebook or MySpace, or text or tweet anything about any aspects of this case, topics, or persons. Don't send any text or tweets regarding any of those subjects, nor access any text, tweets, or messages regarding any of those subjects, nor any blogs regarding any topics or subjects mentioned or involved in the case. This trial is not a trial from television, it is not a revelation from radio, and it is not insight from the internet. This case will be decided based on the evidence in this courtroom, and only the evidence in this courtroom, and the law that I provide to you. Please have no contact or communication whatsoever with the defendant, the attorneys, the witnesses or spectators. Speak, of course, only to other jurors, and I encourage you to do that, but of course on matters entirely unrelated to the trial. And if you become aware of any impropriety, immediately notify the court staff. Do not allow anyone to approach you or have any conversation with anyone about any aspects of this case, nor should you receive any business cards or other contact information so that at a later point you can be contacted by any individual or organization regarding any aspects of this case. These are extremely important admonitions and orders, and I have continued to provide these to you not only in writing but also orally as much as I can. Do all of you continue to understand, assure me you will accept, and unconditionally agree and promise to follow these orders? Yes. Everyone, yes. Thank you. You are ordered also to have a wonderful weekend. And not to get sick, please. I continue to thank you for your patience. We will see you at the regular time. Court will be in recess until 8:45 a.m. You have been remarkably on time despite traffic conditions and other hurdles. So again, I want to thank you. Please have a wonderful weekend, and we will see you in October of 2011, please. Monday, October 3rd, 2011 at 8:45 a.m. Thanks a lot. Good evening and good weekend.
This is the courtroom audio feed from the Conrad Murray trial in Los Angeles, California.